Welcome! I'm absolutely thrilled you're here. Today, we're going to explore something truly fascinating, the cartography of the human body. Think about it. When you look at a map of the world, you rely on a standard set of coordinates and directions, right? That way you don't get lost. Well, the human body is incredibly complex, and medical professionals need a foolproof way to navigate it without dangerous miscommunication. So, in this explainer, we're going to unpack the standard terminology used to map the human body. We'll be focusing heavily on the concept of anatomical position, which really serves as the ultimate anchor for everything else we're going to discuss. Okay, let's dive right into this.
Imagine you're a doctor reading a patient's chart, and you see a note about a scar located above the wrist. Pose this question to yourself for a second. Where exactly is that? Does above mean toward the fingers, like 2 inches away from the hand? Or does it mean up toward the elbow? And is it on the palm side or the back of the arm? It's a really simple question, but it highlights a massive problem. You see, in medicine, using everyday directional words creates a total chaos of ambiguity, and that can lead to huge confusion or even life-threatening errors. We absolutely need a precise, standardized language to eliminate that ambiguity entirely.
Think of our journey today as learning the legend for a map. Here is our roadmap. 1. The language of anatomy. 2. True north, which is anatomical position. 3. The body's compass directions. 4. Grid lines, or anatomical planes. And 5. Mapping the internal cavities.
Section 1. The language of anatomy. Let's look at how exactly we solve this problem of spatial ambiguity. The solution actually lies way back in the past. Anatomical terms derive primarily from ancient Greek and Latin words. Now, you might be wondering why use dead languages? Well, because literally nobody is chatting in ancient Latin at the local coffee shop, the meaning of these words never evolve. They are completely frozen in time, and this creates a highly precise universal vocabulary. When medical professionals communicate, they use words made of specific roots, prefixes, and suffixes that mean the exact same thing to a doctor in Tokyo as they do to a surgeon in Toronto. It's brilliant. Section 2. Anatomical position. Now that we have the language, we need our map's true north. This is anatomical position. It is the absolute reference point for the entire human map. What's fascinating about this is that it doesn't matter if the patient in front of you is lying face down, which we call prone, or face up, which is supine. Doctors always describe locations on the body as if the patient were standing in this exact standard position. It completely standardizes the way we view the human body. Here is how you actually achieve it. First, stand upright. Keep your feet shoulder-width apart and parallel, with your toes pointing straight forward. Your arms should be held out slightly at your sides, and, now this is the absolute key, your palms must be facing forward. I actually want you to imagine physically standing in this exact posture right now. Feel how your palms rotate to face the front. Locking this image into your memory is essential because every single directional term we learn next is based entirely on this exact unmoving stance. Section 3. The body's compass directions. With our base map completely established, let's learn how to navigate. Just like north and south, anatomical directions usually come in binary pairs. First up, we have anterior, which is also known as ventral, versus posterior, or dorsal. Anterior simply means toward the front of the body. Posterior means toward the back. So thinking back to our anatomical position, your toes and your kneecaps are anterior. Meanwhile, your shoulder blades and your heels are posterior. It's just a straight line from the front to the back. Next, let's draw our attention to the vertical axis. We have superior, sometimes called cranial, which means above or higher, basically toward the head. The direct opposite is inferior, or caudal, meaning below or lower, toward the tailbone. So your eyes are superior to your mouth, but your pelvis is inferior to your abdomen. It tells us exactly where we are on that vertical high-low spectrum. Now, navigating the limbs is a bit trickier, and it requires a special set of terms, proximal and distal. Proximal means nearer to the trunk of the body, or the point where the limb attaches. Distal means farther away from that attachment point. Remember our confusing above-the-wrist example from earlier? Well, using these terms, we can cleanly state that the hand is distal to the elbow, meaning it's further down the arm. But the shoulder is proximal to the elbow, meaning it's closer to the trunk. Suddenly, there's absolutely no ambiguity whatsoever. Section 4. Anatomical planes. These are the imaginary 2D grid lines that slice through our 3D map. Modern medical imaging, like MRI or CT scans, relies entirely on these virtual slices. There are 3 primary planes we really need to know: the sagittal plane, the frontal or coronal plane, and the transverse or axial plane. Let's break down how each one cuts through the body. First step is the sagittal plane. This is a vertical slice that divides the body, or a specific organ, into right and left sides. If this vertical cut goes straight down the exact midline of the body, giving you perfectly equal right and left halves, it's specifically called a mid-sagittal or median plane. Next, we have the frontal plane, which is also known as the coronal plane. This is another vertical cut, but instead of left and right, it divides the body into an anterior or front portion and a posterior or rear portion. Now, what's really interesting here is the name coronal. Corona is actually Latin for crown. If you imagine sliding a crown straight down the sides of your head and body, it cleanly slices the front half away from the back half. The third grid line is the transverse plane. Unlike the first two vertical planes, the transverse plane is a horizontal slicer. It divides the body into superior, upper portions, and inferior, lower portions. When doctors are looking at a transverse scan, they are essentially getting a top-down cross-section view of the body's internal structures.
Section 5. Mapping the internal cavities. Now that we know how to slice the body, let's explore the functional territories that house our vital organs.
The body is neatly divided into two massive compartments. On the posterior or backside, we have the heavily protected dorsal cavity, which holds the brain and spinal cord. Think of it like a bony vault. Then, on the anterior or front side is the much larger ventral cavity. This one is subdivided into the thoracic cavity up top and the abdominopelvic cavity down below. The ventral cavity is super expansive, and that allows organs like your lungs and your stomach to freely expand and contract as they do their jobs. But what actually separates the top half of that ventral cavity from the bottom half? That would be the diaphragm. The diaphragm is a crucial, dome-shaped respiratory muscle. It acts just like a physical border wall, forming the floor of the thoracic cavity, safely and completely separating your heart and lungs above from the entire digestive system in your abdominopelvic cavity below.
Because that abdominopelvic cavity is so incredibly massive and contains so many different organs, healthcare providers need a way to map it clearly. They typically divide it into 4 manageable quadrants. Picture a vertical line and a horizontal line intersecting perfectly right at the patient's navel or umbilicus. This gives us the right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. And here is exactly why this matters so much in the real world. Let's say a patient comes in with severe pain. The doctor notes the mass is in the RLQ, the right lower quadrant. When another provider comes in to reassess the patient later, that standard abbreviation tells them instantly and exactly where to look. They know that the stomach sits way up in the left upper quadrant, but the appendix sits down in the right lower quadrant, so they immediately know to check for appendicitis. This structured mapping saves time, prevents dangerous confusion, and vastly improves patient care. We've covered a whole lot of ground today, from the rigid rules of anatomical position all the way to the quadrants of the abdomen. So I want to leave you with this provocative thought. How does this universal map, rooted in dead languages like ancient Greek and Latin, manage to unite a fast-paced, highly advanced global medical community today? You see, mastering this standard terminology isn't just about memorizing a bunch of weird words. It's really the ultimate passport to understanding the incredible, complex journey of human physiology. Thanks for joining me on this explainer, and keep exploring.